Thank you and welcome to elitehealthonline.com. Thank you for joining us today. Today we have guest Sadia Shaki from Texas Star Pharmacy. Welcome, Sadia.
Thank you so much.
Hey, we're going to talk about a little bit of a complex subject today. We know that many providers out there, patients come to us and they say, my doctor had me on TRT, but I was never taking an estrogen blocker. Could be concerning. There are different schools of thoughts, and there's actually difference in how some individuals can handle therapy. Some individuals need no estrogen blocker, no aromatase inhibitors, such as Arimidex or anastrozole. Other patients need more. This is a complex conversation. I've been on therapy 10 plus years, and I've tried to go to very little, to higher doses, to absolutely none. And I'm pretty flexible. I know some of the symptoms I experience on both spectrums, but it's different for every individual. Sadia, I wanted you to talk today, if you don't mind, to our audience a little bit about this subject and how important it is when a provider is trying to dial that number in where they need to be and help them manage with Arimidex or anastrozole.
Absolutely. So, like the way you said, it's an aromatase inhibitor, anastrozole, Arimidex.
Mm-hmm.
And what it does, it prevents the conversion of testosterone into estradiol, which is E2, or the most commonly active form of estrogens. Just before we specifically talk about anastrozole in general, we just need to understand same thing, like women need definitely way more estrogen, estradiol in their body than male, because the fertility cycle, right? But in male, estradiol is also very critical. And it's a lot has to do with their brain function, their cognition, their dexterity. If they don't have enough levels of anastrozole, the balance, if it's not there, estrogen, if they don't have the right levels of the estrogen, their ability to perform, cognitive function really declines. You have seen, probably this, a lot more, that women can be a great multitasker where they can handle, 8 different things at once, versus men are usually, they focus on one thing at a time. When they're done, then they start. So what makes us this way is because of the right amount of estrogen. So
what I hear you saying there, though, is that many men come to us, they think estrogen's the enemy. It's going to negatively impact me. Sounds like you're saying it's important to have a good balance for mental cognition, but also body performance, right? Aren't there some sexual side effects to knocking out all of the estrogen?
Absolutely, yes. Libido declines when you don't have enough estrogens in your body.
Yeah.
So again, between male and female, I know we are specifically discussing it from male's point of view, but always remember, just like female needs a small amount of testosterone for them to feel normal, for their all physiological functions that are happening, same thing men need. And men in their healthy adult life, when they are young, they produce a good amount of estrogen that helps them with their all focus studies and all those things that happen. The key here is the balance, that optimal level. There is a lower level, there is an upper level, and you have to stay somewhere in that optimal level for all these functions to happen without causing any imbalance. So yes, if somebody is, sure.
No, I was just going to say that's not something that a doctor can prescribe universal across all patients. I prescribe X amount of anastrozole or Arimidex per week. This is really something that each patient has to work with their own, what's their body telling them, how do they feel mentally, sexual performance, and really figure out where, and through lab values, again, it comes back to the importance of why we run lab values like we do, is we want to know how you're feeling and base where is your estradiol at that time. Because again, every patient will feel different at the same estradiol level. So it's correct in thinking that this is not a one size fits all. It's important to really dial in each patient into where they feel best.
Absolutely. And this is so critical because this aromatase enzyme, which is responsible for the conversion, let's imagine that it's in our skin, it's in our adipose tissues, it's in our bones and areas of the brain. So this actual enzyme is everywhere, In some patients, it's hyperfunctional, and in some, it's normal, and in some, it's very low. Just like we talked about the example of caffeine. Caffeine is metabolized by cytochrome P450, which is a very common, enzyme system. From the same enzyme system, there is another enzyme that actually, produces or aromatase. So just like that, if I can handle tons of caffeine, that because my enzyme is hyperfunctional and it's helping me, to take as much dose as I want for caffeine and without any problem. But if somebody does not have the right enzymes, or if they have too much or too little, how my body is going to convert that testosterone into estrogen is going to be fully dependent on that. So pharmacogenomics is another, branch of pharmacy that looks at the genetic composition, and that's where I can see some of the frustration that the patients have a lot of time. That hey, it's not helping. My estrogen levels are not dropping. Or if I don't need it. I'm not producing any estrogen, because that's where the doctor is very able to help you figuring out that you are the right candidate or not. Because sometimes even for the doctors, they don't have a special, stethoscope or magnifying glass to look at your genome, or genetic
No,
makeup. So a lot of time,
yeah, you really need a provider that understands that you're an individual. That's what we really do different, and that we need to dial you in specifically. We need to start you off on TRT with a certain amount of anastrozole, see how you feel, and then up that or lower that depending on your lab values and what makes you feel best. Because some men again can run TRT with no aromatase inhibitor at all and be fine. And there is that school
yes,
of thought, and others they have learned through other physicians that knocking estrogen is the enemy to body fat, therefore let's knock it out completely. And then they suffer those negative consequences. So I
and
think what
yes,
you
and
stress is the importance of the balance, right? It's about the balance.
yes, balance. And I can tell you one thing: those people who say that produce a lot of estrogen when they are on testosterone therapy, a lot has to do with their inflammatory lifestyle, where the diet is not good. It's a very
Yeah.
imbalanced diet, or lack of exercise, or even if they are doing the both of those good, stressors. Stress is over
Mm-hmm.
the peak. And what happens, all these things, when either one of them is imbalanced or all exist together, then it lowers our body pH, acid-base balance. And when this balance is off and we are more acidic, that's when this enzyme, aromatase enzyme, gets activated or super activated. And then
Yeah.
next thing you know, more testosterone is converting into estrogens, and patients are having, issues with their mood instability, or more of a female related, symptoms and physiological changes in their body as well. So it
Right.
is really a combination of, better lifestyle,
Yeah.
meditation that reduces the stress, and then again, you guys, like, doctors who can actually help, stabilize their numbers.
Yeah. Sorry, this is so awesome. Thank you so much for your time today. Again, folks, nothing on today's conversation is meant to be used for diagnostic or treatment purposes. But if you are looking for a clinic that'll treat you individually, help you manage through this somewhat complex component of TRT therapy, of getting your estradiol levels managed correctly with the appropriate therapy, click the link there, visit us today. Let's get some lab work and get you on your way to being elite. Thank you for joining us today.
Thank you.